So just a few things I wanted to kind of touch on today. I wanted to talk a little bit about why we decided to change. What were some of the key drivers that made us transition and start looking at various opportunities to do things better. Talk a little bit about that journey to hospitality, because it is a journey. We're talking now 3 years from the time that we actually started this. I think most of you who are faced with change, particularly a very deep cultural change, realize that it's a very slow process. You need to build a very solid foundation to ensure that you've got the ground to stand on as you continue to progress and complement and add to that foundation. We're going to talk about how important the HQ partnership has been in helping guide us along the road of that journey. We're going to share our results with you. Our results are great, big jump, but they're nowhere near where we need to be. It's type A, right? And we're also going to talk about program sustainability, because again, you really never stop. Just a little bit about the North Shore LIJ health system. We are big, and every time we turn around it seems like we're getting bigger. We're currently made up of 16 hospitals. We have 5 tertiaries, we have 7 community, 3 specialty hospitals, and we have 1 affiliate. If you count all those beds, it makes us the 3rd largest nonprofit secular healthcare system in the country. And we serve an area of about 7 million people, which includes Long Island, Manhattan, Queens, and Staten Island. We had 3 key factors that really drove the fact that we needed to change where we were. The most compelling was that Michael Dowling, our president CEO of the health system, made it very clear that we had a new building coming up. What better opportunity to change your image than when you're undergoing a major physical transformation? And he made it very clear that there was no way that we were going to be successful if we went into this brand new beautiful building and had a brand new beautiful entrance if people did the things that they did currently. They needed to change their attitude, and we needed to change how we delivered care to our patient population. So when we sat around and thought about, where are we going to go? What are we going to do? We had a small group of individuals across, actually, LIJ is made up of 3 separate hospitals that all report up through 1 license. And all 3 of us sat down together and said, well, we need to really change, because actually all 3 facilities were undergoing some significant facility renovation. So we started thinking about what we traditionally do and realized that healthcare is very set in its ways. And that probably wasn't going to move us in the direction that we needed to move. And one of the executive directors actually at our children's hospital had heard about Danny Meyer's restaurants doing so well. And that's when we found out about HQ. So we started initiating some discussions with HQ. And as you will see in what's on the table, is that they did an assessment and gave us some feedback in terms of some of the things where we could improve. So we mulled it over a little bit. I had had numerous discussions with Aggie about the fact that Press Ganey is the survey tool that we use. And for many, many years we'd been using Press Ganey. We were in the 5th percentile. And we realized that we were tending to use, and the history had been that people were tending to use, because I was relatively new to LIJ at the time, we were using Press Ganey as if it were the tool, as if it were going to drive the change. Or you look at those scores, you got to change the scores. Well, that's not going to go anywhere. We intuitively knew what we weren't doing right. All we needed to do is figure out how do we start changing and converting that over into something that was going to change the organization and how we did things. So we had a number of discussions with Susan and the whole HQ team, and we really were struck by one discussion in particular, and I think that was really the pivotal moment when we realized that this was the way that we needed to move. When Susan was asking us how we thought we would like to deploy this throughout the organization, we were very patient-centered. We're all in healthcare, okay? Patient is at the center of the universe. Every decision you make, everything you do is all centered around the patient. And she kind of stopped and she said, well, you know, I said, we're going to have to, our leaders have to understand, focus on the patient and figure out how we're going to change all of this. And she said, you know, what we realize in the restaurant business is if the waiter goes back and is confronted by a chef that's not really happy that day, and that chef turns around and yells at the waiter who has started a really beautiful meal for the visitors at that time, he's going to come out after he's been yelled at, made to feel unimportant, and all of a sudden, that chain is broken. It really created for us a total paradigm shift. And when we decided to embark on the HQ model, it was around employee engagement as our primary focus. All of a sudden, it was around if the employees do not feel respected, if they're not engaged, if they don't feel that they're part of the change process and we hear what they have to say and they're included in these change processes, we probably will never be able to get there because they'll never act right with our patients. They're never going to be able to feel comfortable enough to feel that this is theirs. So that was a real transformational moment, and I think that was the foundation of so much of what has been successful in what we've accomplished at NSLIJ through this process. On the Press-Ganey likelihood to recommend, you can see in 2011, which is where we started, and that's when we began our partnership with HQ. That first year, even just the teaching alone, as we started getting it out of the gate, made a tremendous impact in terms of the culture within NSLIJ. So by 2012, if you look at our scores, we were at 89.5, which brought us from the 5th percentile up to the 50th percentile. That is an incredible leap in a very short period of time. Now, I don't need to tell all of you 50th percentile isn't so great either. But the good news is we're continuing to still move up in the right direction. The challenge is going to become that much harder because everybody else across the country is doing the same thing. But everybody's excited. All they want to do is see the dial go up, and that's what we need to keep alive and well. And then the HCAHPS recommending the hospital scores also went up significantly from the 45th percentile to the 82nd percentile. So we have still a lot of work to do. We recognize that, but that's part of a journey. It is an absolute, it has to be driven from the very top of the organization. If the individual that's leading the organization does not believe this, it will go nowhere. Because then people know that it's not going to continue. And you can only go so far if the leadership is not 100% engaged in this. So it came from me, included all of the leadership team, and that is an imperative. And we all believe it. It's very, very exciting when you see this all working. Engaging employees, it goes back to that paradigm shift to where the employees are at the center. Employees come first, patients come second. It's the only way you're going to make your patients come first. They need to believe it. And they're only going to believe it if you walk it, you talk it, and you demonstrate it day after day after day. The minute you fall short and you do something that deviates from that, they're going to fall back into their prior patterns. So it has to be something that you maintain. So it needs to be pervasive, has to go throughout the entire organization. There's no one that's off the hook. and it's a non-negotiable. A little strong wording. You don't, obviously that's not the way it presents, but that really is what you're trying to do. You got to make it fun, okay? You celebrate. Every time you celebrate and you tell people that they're doing a really great job, and even when things are down, so when I go into an open forum, particularly on the night shift, and I show them that the scores have dropped, you actually see them kind of, they work so hard. And then to see just an increase in volume create such a drop in the scores, it affects them. But the fact that it affects them is great because it means they care. And the next month, invariably, pops right back up. So you have to communicate. You have to let them know that you're seeing the things that are happening. You have to keep them engaged, and the only way you can do that is through communicating. And probably the most important of all is there is no end to improvement. And a lot of this transformation, I think Kathy can appreciate this. You're moving from a teaching organization that's kind of a top-down directive to a learning organization where people learn, absorb, and then they come back to you with ideas. We have more ideas and more feedback than we know what to do with, which is a great place to be.